We've received many questions from clients and other people who had questions, and we wanted to share those questions and answers. So the first question was, does software as a medical device require design documentation as described in ISO 1345? And the answer is yes. You have to follow the requirements of ISO 1345. And as part of ISO 1345, as part of the software as a medical device, you should be looking at meeting the requirements of IEC 62304 with the software lifecycle process. In the IEC 62304, it specifies what are the documents that you need to meet. The second question is an MDSAP certificate, does an MDSAP certificate cover a product or does it cover the company? The answer is both. You have your MDSAP certificate covers the scope of the operations that you do, and it should mention the products that you want to license. So in the case where Health Canada would be looking at your MDSAP certificate, you'd want to make sure that the items that you want, the medical devices that you want to license, are covered in the scope of the MDSAP. So it's important to pay a lot of attention to the wording to make sure that it corresponds. The third question is, do you need procedures for corrective preventive action if you are a startup and that is only doing design development? The answer is yes, because even within your design development process, there may be instances where you may want to issue a corrective action or preventive action. And the corrective and preventive action is the basis, it's the basic part of the quality system, and it's something that you use to solve problems. So it is quite important, and it's not difficult, but it's quite important to have that process in place. The fourth question is, what is the Health Canada regulatory enrollment process? So starting in January 1st, 2026, it will become mandatory for companies to submit their Class 2, Class 3, Class 4 license and amendment applications to Health Canada, along with the private label license and also the private label amendment. This means that this is the only way that you're going to be able to communicate with Health Canada. And it's quite a process to go through. So we recommend that everyone look at the requirements, and if you have any issues with the requirements or you need any help, you can contact us. Please don't hesitate to contact us if you have any questions related to medical devices, regulatory and quality management services. Thank you.